I'm Breonny Robson. I'm the General Manager of Clinical and Research at Kidney Health Australia. I'm really pleased to be leading this area of our work, which is evidence-based content and guidelines and programs for healthcare professionals, particularly those working in primary care, but really trying to foster connections between the work we do at Kidney Health Australia in supporting patients and the work that is happening in the clinical setting with GPs and other healthcare professionals managing kidney disease.
I'm Dr. Chris Bollen. I'm a GP at Oakden Medical Centre, northeast suburb of Adelaide. My clinical practice there consists of a lot of people over the age of 50 to 100, and as a result, there are a lot of people that have got at least one or two risk factors for chronic kidney disease. So in this work, in my practice, I've got to be very aware of chronic kidney disease. The other area of my work that I get involved with is a lot of teaching and training of other doctors and nurses on the topic of frailty, dementia, healthy ageing and chronic kidney disease. So this is one of this grouping of clinical areas is a huge issue for Australia currently.
The work started early last year. We worked very closely with our advisory committee, PEAK, which is made up of nephrologists and GPs, primary healthcare nurses, renal nurses. And we work closely with that committee to evaluate the evidence. So what's been published on new treatments, what's been published to add to the body of evidence around kidney disease. How does that impact the messaging that we put out as an organisation? What international guidelines have been published, what national guidelines, and we pull all of that information together and overlay that with some sense and practicalities. So we're really looking at the evidence base, but also clinical consensus, and marrying those two pieces together to come out with some really simple and practical recommendations for primary care.
Kidney disease is one of the biggest emerging issues in this country. So the way Kidney Health Australia has had me involved as a GP is I'm part of a group called PEAK, which is the Primary Care Education Advisory Committee of Kidney Health Australia. And we're a group of nephrologists, GPs, primary care nurses, renal nurses, pharmacists, as well as paid staff from Kidney Health Australia. This group gets together around about 4 times a year, and we together review the literature that's coming in across the world about new ways of assessing and addressing and managing chronic kidney disease. And as a result of our discussions, we look at whether the evidence is whether this evidence is changing what we need to be doing in everyday practice. So Kidney Health Australia, on our behalf, will put out messages and communication to primary care groups across Australia to let them know that there are changes in the way that we can screen for or assess and manage chronic kidney disease.
My name is Shilpa Jesudason. I'm a Professor of Medicine at Adelaide University. I am the Director of Dialysis at the Royal Adelaide Hospital, and I was the Clinical Director for Kidney Health Australia until 2020. The 5th edition of the CKD Management in Primary Care Handbook has really reflected some advances in treatments for chronic kidney disease that weren't available when we did the last edition. Some really exciting and effective new therapies that have come through around preventing progression of chronic kidney disease in the SGLT2 inhibitor drugs that are now being taken up. We also had advances in new guidelines for First Nations patients with chronic kidney disease and how to best care for them in a culturally appropriate and sensitive way. We revisited the referral algorithms and ensured that they reflected best current evidence. And we generally gave the handbook a refresh and update, ensuring that all the content was really highly relevant to GPs and could be easily accessed and help answer the questions that they wanted answered about chronic kidney disease.
The handbook is targeted towards all healthcare professionals, particularly those working in primary care. So that's GPs, primary healthcare nurses, Aboriginal health workers who are working both within a city or in remote locations. So we really try to have practical, simple messaging for all of those groups. And one of the, I guess, the key things that the handbook adds is how people can work as part of a multidisciplinary team when managing kidney disease. So the target audience is healthcare professionals, but it's not just for GPs, it's for any healthcare professional working in that space. We also within the book cover things like referral to nephrology units. And so there's that piece between what's happening in primary care, which is where CKD lives and is often diagnosed and managed in its early stages, and then the tertiary care, so your renal units who are managing patients once they progress to kidney failure. And we're really looking at, with some of those recommendations, how those different levels of the healthcare system can work collaboratively to achieve the best outcomes for patients.
The whole purpose of this handbook from its inception some years ago to the latest edition now is really to help primary care clinicians focus on the early detection and best practice management of chronic kidney disease. We know that this is still being underdone in Australia. We know that 1 in 10 adult Australians have got risk factors for chronic kidney disease and biomedical markers of chronic kidney disease. And we know that you can lose up to 90% of kidney function without knowing about it. We know that waiting until people have symptoms or present with end-stage renal failure is leaving it too late. We've now got a suite of new drugs that we can use to slow down the progression of chronic kidney disease, which we didn't have when we had the 4th edition of the handbook. The 5th edition now really focuses on that. And early detection has never been more important in this new era of better treatments for chronic kidney disease. If we can't find this disease, we can't apply those new treatments, and that's why it's so imperative to have this focus on early detection. The handbook really puts a highlight on that. It gives very clear guidance on how to go about screening high-risk populations for chronic kidney disease, and then very clear action plans on what to do when you do find those markers of chronic kidney disease and putting in the best practice care. Without this handbook, I don't think we would be able to really push that message in the primary care setting, and that's where most of the chronic kidney disease in Australia is currently sitting.
There are a number of changes that are very important. The first is the recommendations about new medications, and that there are 2 groups of medications that for the first time are on the PBS, and that can be prescribed by GPs for people with chronic kidney disease to slow the progression of that condition. So for the first time, GPs can actively prescribe a medication which has got huge impact on reducing end-stage renal disease. And in the past, all we've had is the option to reduce people's blood pressure and give them lifestyle advice. Now we've got medication. So the SGLT2 inhibitors is a class of drugs that GPs can prescribe for people with chronic kidney disease and who have a raised urine ACR. And this is really, really important because it slows progression. The other important change for GPs in Australia to be aware of is the PBS has a medication called a non-steroidal MRA, which can be prescribed for people with chronic kidney disease and microalbuminuria. So this again is a new drug that can slow the progression of chronic kidney disease. And its impact is huge in prevention of long-term issues. The other changes in this handbook include discussion about contraception and pregnancy in women who have existing chronic kidney disease. That's a rising group within our community, so important that GPs get their head around this group. Another area discussed is diet and nutrition for people with chronic kidney disease. And finally, and very importantly, is there's an updated algorithm for referral of people with chronic kidney disease to a nephrologist. And this is really important because not everyone needs referring. And the highlight is that anyone that's got an EGFR less than 30 mils a minute, we should consider referral. But very importantly, those people that have got a 15% drop or more in their EGFR over a 12-month period, they should also be referred as a matter of urgency because something is definitely changing that needs a specialist opinion. It's been endorsed by the RACGP and ACRM, so the two peak bodies of general practice training in this country. Also, the Australian Primary Care Nurses Association have endorsed the document. So the three top groups have said this is a great document and are prepared to put their name to it.
We also have sought endorsement from the peak bodies that are involved both in primary care and in nephrology and nephrology nursing.
We've also worked with some of our industry partners, so some of the pharmaceutical companies who work in the space have helped us through their networks to get the word out as well, which has been great because it allows us to not just have this product, but to actually get it out into the field and being used. We launched the handbook on World Kidney Day, which was in mid-March, and that was a really exciting event. We had the South Australian Health Minister launching the handbook here in Adelaide. We had a number of stakeholders from the kidney community. We partnered with the Royal Adelaide Hospital.
It was really exciting to be part of the launch of this new guide to help GPs in terms of the management of kidney disease across the country, and to make sure that all of our doctors who are on the front line of providing that healthcare can be given the latest information, the best possible evidence base to be able to help their patients. We know that unfortunately kidney disease has a real significant impact on our community, not only in terms of the health impacts but also the economic impacts as well. And of course there is increasing demand on dialysis services, there's increasing demand on transplant services, and we want to try to keep people as healthy as they possibly can be. So bringing that evidence together, that best practice, and disseminating that for all of our doctors across the country to help manage that is really important. So we're delighted to be part of that launch. We were bringing together clinicians, doctors, nurses, but also patients together to celebrate the launch of that document.